Hi, I'm Dr. Brad Hasilo, Strength and snu-therapy. I'm here with Bonnie. We're going to be talking about plantar fascia today, plantar fasciitis specifically. So your plantar fascia goes from the heel to the base of all your toes, and it helps keep things from separating and support that arch. What can happen is when it gets inflamed, it's usually around the bottom of your heel here. You'll usually get point tenderness right on this middle aspect of the heel bone and up through the arch. The first few steps in the morning or after a long period of being seated, such as driving or going to see a movie, are usually the worst, and then it becomes a little less severe. This is usually a self-limiting condition, but we're not talking days, usually a couple weeks, even a couple months, depending on how severe it is. Some predisposing factors or things that can bring on plantar fasciitis are an increase in volume or type of training, weak intrinsic foot muscles, so the muscles that help support that arch. So you know, we just came out of the winter into the summer. People are switching to those cheap flip-flops or the snu minimalist shoes that can really stress those muscles, the tiny muscles in your feet. And a lack of dorsiflexion, or being able to pull your toes towards your knee, can also cause too much wear and tear on this plantar fascia. Alright, so for treatment we start by assessing the small muscles in the bottom of the foot. If there's any tension through there, they can get pretty tight and spastic, so we'd feel around any tension points, we'd get in on, and we just strip them out to help them relax, give them a kick start towards turning off for us so we can restore normal foot mechanics. We'd also have a look at the bones in the feet, notably the cuboid, which ends at the base of your fifth toe here, the navicular bone, which is the first bone after your ankle proper, or in the midfoot, and the talus bone, which your shin bone sits on and is where you get most of that motion for dorsiflexion and plantar flexion from. If those were restricted in any way, shape, or form, we can do a chiropractic adjustment to help restore motion between the joints in the foot, and thereby restoring normal joint mechanics throughout the foot complex. Getting a little further away from the actual site of the problem, we look at the muscles in the back of the leg, the gastroc soleus complex, which form your Achilles and attach to your heel, can pull on this, which will, one, limit that dorsiflexion, and two, put tension through the plantar fascia, which attaches on the other side of the heel bone. Also, we have the deep muscles in the posterior compartment here, tibialis posterior, which comes down and helps support that arch, and your two flexor muscles. One flexes the big toe, the other flexes all your rest of your toes. So we'd be looking for tension points or just a lack of compliance in them, and we'd stretch them out using some functional soft tissue therapy, which we'll go through next. So for the functional soft tissue, we're stretching out the muscles in the back of the leg here that we just discussed. I like to make this a little more active and use the body weight to help really get that stretch through those muscles. So would have previously already found a tight area or areas in the back of the leg. So what we do is we have Bonnie set up to do a body weight squat here, which she's ready to do. I'll take my contact on that tight area, put some tension through it, and then we have her squat down until her bum touches my shoulder. Good. And we'll do two more. Excellent. And we just work our way up and down the back of the leg until all those knots or points of tension were gone, or at least reduced quite a bit. Stuff that Bonnie could do at home, or stretches, to get into the same area. I'll have her put this leg back. So this is the leg we're stretching. We'll keep her hips square to the wall. Toes for now pointing towards the wall. Keeping that heel on the floor and that knee locked out. We'll have her slowly bend her front leg. And she should feel the stretch through here. This is for the gastrocs because it crosses both the heel and the knee joint, sorry, the ankle joint. And then we'll have her come out of that stretch, move this foot a little bit forward. Good, and we'll bend the knee this time, keeping the hips square to the wall. And that slacks out the gastrocs and gets the deeper muscles throughout the back of the leg. And then what we can have her do is externally or internally rotate her foot, keeping those hips square, and that'll bias the different muscles and the different tissues through the back of the leg compartment. Alright guys, so that was a quick overview of the symptoms of plantar fasciitis and a crash course on how we treat it here. If you're experiencing any of those symptoms and the stretching and strengthening doesn't seem to be helping, be sure to come on in, get it checked out. Because everyone's different, so I mean those 3 exercises and a couple stretches may just not do it, and we can definitely help facilitate and kickstart the healing process to get things cleared up a little faster. I'm Dr. Hasilo, chiropractor at Snu-Therapy. Thanks for watching.